Hello and welcome back to my channel, or if you're new here, welcome to the channel where I strive to inform you guys about mental health topics and related things associated with that. Today I will be doing a video follow-up to my previous one titled Overview of Bipolar Disorder, where I will be digging deeper into the diagnosis and treatment of this disorder. Diagnosis. To determine if you have bipolar disorder, your evaluation may include a physical exam. Your doctor may do a physical exam and lab tests to identify any medical problems that could be causing your symptoms. A psychiatric assessment. Your doctor may refer you to a psychiatrist who will talk to you about your thoughts, feelings, and behavior patterns. You may also fill out a psychological self-assessment or questionnaire. With your permission, family members or close friends may be asked to provide information about your symptoms. Mood charting. Your doctor may ask you to keep a daily record of your moods, sleep patterns, or other factors that could help with diagnosis and finding the right treatment. Criteria for bipolar disorder. Your psychiatrist may compare your symptoms with the criteria for bipolar and related disorders in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, published by the American Psychiatric Association. Diagnosis in children. Although diagnosis of children and teens with bipolar disorder includes the same criteria that are used for adults, symptoms in children and teens often have different patterns and may not fit neatly into the diagnostic categories. Also, children who have bipolar disorder are frequently also diagnosed with other mental health conditions such as ADHD or behavior problems, which can make diagnosis more complicated. Referral to a child psychiatrist with experience in bipolar disorder is recommended. Treatment. Treatment is best guided by a medical doctor who specializes in diagnosing and treating mental health conditions. In other words, a psychiatrist who is skilled in treating bipolar and related disorders. You may have a treatment team that also includes a psychologist, social worker, and psychiatric nurse. Treatment for bipolar disorder aims to reduce the severity and number of episodes of depression and mania to allow as normal a life as possible. Bipolar disorder is a lifelong condition. If a person is not treated, episodes of bipolar-related mania can last for between 3 to 6 months. Episodes of depression tend to last longer, often 6 to 12 months. But with effective treatment, episodes usually improve. Most people with bipolar disorder can be treated using a combination of different treatments. These can include one or more of the following. Medications. Often you'll need to start taking meds to balance your moods right away. Meds to prevent episodes of mania and depression are known as mood stabilizers. They should be taken every day on a long-term basis. Meds to treat the main symptoms of depression and mania when they happen. Learning to recognize the triggers and signs of an episode of depression or mania. Psychological treatments such as talking therapies, which help you deal with depression and provide advice on how to improve relationships. Lifestyle advice such as doing regular exercise, planning activities you enjoy that give you a sense of achievement, and advice on improving your diet and getting more sleep. Most people with bipolar disorder can receive most of their treatment without having to stay in the hospital, but hospital treatment may be needed if your symptoms are severe. Hospitalization. Your doctor may recommend hospitalization if you're behaving dangerously, you feel suicidal, or you become detached from reality, or other words, psychotic. Getting psychiatric treatment at a hospital can help you keep calm and safe and stabilize your mood, whether you're having a manic or major depressive episode. The primary treatments for bipolar disorder include meds and psychological counseling, also known as psychotherapy, to control symptoms, and also may include education and support groups. Continued treatment. Bipolar disorder requires lifelong treatment with meds, even during periods when you feel better. People who skip maintenance treatment are at a high risk of a relapse of symptoms or having minor mood changes turn into full-blown mania or depression. Day treatment programs. Your doctor may recommend a day treatment program. These programs provide the support and counseling you need while you get symptoms under control. Substance abuse treatment. If you have problems with alcohol or drugs, you'll also need substance abuse treatment. Otherwise, it can be very difficult to manage bipolar disorder. Medications. A number of meds are used to treat bipolar disorder. These types and doses of meds prescribed are based on your particular symptoms. Meds may include mood stabilizers. You'll typically need mood stabilizing medication to control manic or hypomanic episodes. Examples of mood stabilizers include lithium, depakine, Depakote, carbamazepine, Tegretol, Quatro, and others, and lamotrigine. Also in the UK, lithium is the main med used to treat bipolar disorder. Lithium is a long-term treatment for episodes of mania and depression. It's usually prescribed for at least 6 months. If you're prescribed lithium, stick to the prescribed dose and don't stop taking it suddenly unless told to by your doctor. For lithium to be effective, the dosage must be correct. If it isn't, you may get side effects. Effects such as diarrhea and getting sick. Tell your doctor immediately if you have side effects while taking lithium. You'll need regular blood tests at least every 3 months while taking lithium. This is to make sure that your lithium levels are not too high or too low. Your kidney and thyroid function will also need to be checked, usually every 6 months. While you're taking lithium, avoid using non-steroidal anti-inflammatory drugs or NSAIDs, such as ibuprofen unless prescribed by your doctor. In the UK, lithium and the antipsychotic med aripiprazole are currently meds officially approved for use in teens with bipolar disorder. Antipsychotics. If symptoms of depression or mania persist in spite of treatment with other meds, adding an antipsychotic drug such as olanzapine, Risperdal, Seroquel, Abilify, Geodon, Latuda, or Safaris may help. Your doctor may prescribe some of these meds alone or along with a mood stabilizer. Another antipsychotic med is haloperidol. They may also be used as a long-term mood stabilizer. Quetiapine may also be used for long-term bipolar depression, as antipsychotics can cause side effects such as blurred vision, dry mouth, constipation, and weight gain. The initial dose will usually be low. If you're prescribed an antipsychotic, you'll need to have regular health checks at least every 3 months, but possibly more often, particularly if you have diabetes. If your symptoms do not improve, you may be offered lithium or valproate as well. Antidepressants. Your doctor may add an antidepressant to help manage depression. Because an antidepressant can sometimes trigger a manic episode, it's usually prescribed along with a mood stabilizer or antipsychotic. Antidepressant antipsychotics. The med Simbax combines the antidepressant fluoxetine and the antipsychotic olanzapine. It works as a depression treatment and mood stabilizer. Anti-anxiety meds. Benzodiazepines may help with anxiety and improve sleep, but are usually used on a short-term basis. Finding the right medication. Finding the right medication or meds for you will likely take some trial and error. If one doesn't work for you, there are several others to try. This process requires patience, as some meds need weeks to months to take full effect. Generally, only one med is changed at a time, so that your doctor can identify which meds work to relieve your symptoms with the least bothersome side effects. Meds also need to be adjusted as your symptoms change. Side effects. Mild side effects often improve as you find the right meds and doses that work for you, and your body adjusts to the meds. Talk to your doctor or mental health professional if you have bothersome side effects. Don't make changes or stop taking your meds. If you stop your meds, you may experience withdrawal effects or your symptoms may worsen or return. You may become very depressed, feel suicidal, or go into a manic or hypomanic episode. If you think you need to make a change, call your doctor. Medications in pregnancy. A number of meds for bipolar disorder can be associated with birth defects and can pass through breast milk to your baby. Certain meds, such as valproic acid and valproic sodium, shouldn't be used during pregnancy. Also, birth control meds may lose effectiveness when taken along with certain bipolar disorder meds. Discuss treatment options with your doctor before you become pregnant, if possible. If you're taking meds to treat bipolar disorder and you think you may be pregnant, talk to your doctor right away. Psychotherapy. Psychotherapy is a vital part of bipolar disorder treatment and can be provided in individual, family, or group settings. Several types of therapy may be helpful. These include interpersonal and social rhythm therapy, IPSRT for short. IPSRT focuses on the stabilization of daily rhythms such as sleeping, waking, and meal times. A consistent routine allows for better mood management. People with bipolar disorder may benefit from establishing a daily routine for sleep, diet, and exercise. Cognitive behavioral therapy, or CBT for short. The focus of CBT is identifying unhealthy negative beliefs and behaviors and replacing them with healthy positive ones. CBT can help identify what triggers your bipolar episodes. You also learn effective strategies to manage stress and to cope with upsetting situations. Psychoeducation. Learning about bipolar disorder can help you and your loved ones understand the condition. Knowing what's going on can help you get the best support, identify issues, make a plan to prevent relapse, and stick with treatment. Family-focused therapy. Family support and communication can help you stick with your treatment plan and help you and your loved ones recognize and manage warning signs of mood swings. Other treatment options. Depending on your needs, other treatments may be added to your depression therapy. During electroconvulsive therapy, or ECT, electrical currents are passed through the brain, intentionally triggering a brief seizure. ECT seems to cause changes in brain chemistry that can reverse symptoms of certain mental illnesses. ECT may be an option for bipolar treatment if you don't get better with meds. Can't take antidepressants for health reasons such as pregnancy or are at high risk of suicide. Transcranial magnetic stimulation, TMS, is being investigated as an option for those who have not responded to antidepressants. Treatment in children and teens. Treatment for children and teens are generally decided on a case-by-case basis, depending on symptoms, medication, side effects, and other factors. Generally, treatment includes meds. Children and teens with bipolar disorder are often prescribed the same types of meds as those used in adults. There's less research on the safety and effectiveness of bipolar meds in children than in adults, so treatment decisions are often based on adult research. Psychotherapy. Initial and long-term therapy can help keep symptoms from returning. Psychotherapy can help children and teens manage their routines, develop coping skills, addressing learning difficulties, resolve social problems, and help strengthen family bonds and communication. If needed, it can help treat substance abuse problems common in older children and teens with bipolar disorder. Psychoeducation can include the learning the symptoms of bipolar disorder and how they differ from behavior related to your child's developmental age, the situation, and appropriate behavior. Understanding about bipolar disorder can also help you support your child. Support. Working with teachers and school counselors and encouraging support from family and friends can help identify services and encourage success. Lifestyle and home remedies. You'll probably need to make lifestyle changes to stop cycles of behavior that worsen your bipolar disorder. Here are some steps to take. Quit drinking or using recreational drugs. One of the biggest concerns with bipolar disorder is the negative consequences of risk-taking behavior and drug or alcohol abuse. Get help if you have trouble quitting on your own. Form healthy relationships. Surround yourself with people who are a positive influence. Friends and family members can provide support and help you watch for warning signs of mood shifts. Create a healthy routine. Having a regular routine for sleeping, eating, and physical activity can help balance your moods. Check with your doctor before starting any exercise program. Eat a healthy diet. If you take lithium, talk with your doctor about appropriate fluid and salt intake. If you have trouble sleeping, talk to your doctor or mental health professional about what you can do. Check first before taking other meds. Call the doctor who's treating you for bipolar disorder before you take meds prescribed by another doctor or any over-the-counter supplements or meds. Sometimes other meds trigger episodes of depression or mania, or may interfere with meds you're taking for bipolar disorder. Consider keeping a mood chart. Keeping a record of your daily moods, treatments, sleep, activities, and feelings may help you identify triggers, effective treatment options, and when treatment needs to be adjusted. Alternative medicine. There isn't much research on alternative or complementary medicine, sometimes called integrative medicine, and bipolar disorder. Most of the studies are on major depression, so it isn't clear how the non-traditional approaches work for bipolar disorder. If you choose to use alternative or complementary medicine in addition to your physician-recommended treatment, take some precautions first. Don't stop taking your prescribed meds or skip therapy sessions. Alternative medicine is not a substitute for regular medical care when it comes to treating bipolar disorder. Be honest with your doctors and mental health professionals. Tell them exactly which alternative treatments you use or you would like to try. Be aware of potential dangers. Alternative products aren't regulated the way prescription drugs are. Just because it's natural doesn't mean it's safe. Before using alternative medicine, talk to your doctor about the risks, including possible serious interactions with medications. Coping and support. Coping with bipolar disorder can be challenging. Here are some strategies that can help. Learn about bipolar disorder. Education about your condition can empower you and motivate you to stick to your treatment plan and recognize mood changes. Help educate your family and friends about what you're going through. Stay focused on your goals. Learning to manage bipolar disorder can take time. Stay motivated by keeping your goals in mind and reminding yourself that you can work to repair damaged relationships and other problems caused by your mood swings. Join a support group. Support groups for people with bipolar disorder can help you connect to others facing similar challenges and sharing experiences. Find healthy outlets. Explore healthy ways to channel your energy, such as hobbies, exercise, and recreational activities. Learn ways to relax and manage stress. Yoga, Tai Chi, massage, meditation, or other relaxation techniques can be helpful. Preparing for your appointment. You may start by seeing your primary care doctor or a psychiatrist. You may want to take a family member or friend along to your appointment if possible for support and to remember information. What you can do. Before your appointment, make a list of any symptoms you've had, including any that may seem unrelated to the reason for the appointment. Key personal information, including any major stresses or recent life changes. All meds, vitamins, herbs, or other supplements you're taking and the dosage. Questions to ask your doctor. Some questions to ask your doctor may include, do I have bipolar disorder? Are there any other possible causes for my symptoms? What kinds of tests will I need? What treatments are available and which do you recommend for me? What side effects are possible with that treatment? What are the alternatives to the primary approach that you're suggesting? I have other health conditions. How can I best manage these conditions together? Should I see a psychiatrist or other mental health professional? Is there a generic alternative to the medication you're prescribing? Are there any brochures or other printed material that I can have? What websites do you recommend? Don't hesitate to ask other questions during your appointment. What to expect from your doctor. Your doctor will ask you a number of questions. Be ready to answer them to reserve time to go over any symptoms you want to focus on. Your doctor may ask, when did you or your loved ones begin noticing your symptoms? How frequently do your moods change? Do you ever have suicidal thoughts when you're feeling down? Do your symptoms interfere with your daily life or relationships? Do you have any blood relatives with bipolar disorder or depression? What other mental or physical health conditions do you have? Do you drink alcohol, smoke cigarettes, or use recreational drugs? How much do you sleep at night, and does it change over time? Do you go through periods when you take risks that you wouldn't normally take, such as unsafe sex or unwise spontaneous financial decisions? What, if anything, seems to improve your symptoms? What, if anything, appears to worsen your symptoms? I hope that this video has helped someone with questions that they may have related to this disorder. If you have any questions for me, feel free to leave them in the comments section of this video. If you like what I do here at the channel, like this video, comment, and subscribe to my channel, because I started this channel to help people with their battles of their mental health struggles, because the more subscribers I get, the bigger a community we have to discuss mental health struggles and our victories over our mental health struggles. This has been Chris, mental health advocate, and until the next video, I'll catch you on the flip side.